Hi guys, I think I need to clarify some things about the hips. There's a lot of coaches now that are talking more about the anatomy, and sometimes a little information can be a little dangerous if people don't understand what you're talking about. So I was coaching a couple this week, and they were really sitting sideways on their hips and getting a very awkward line and a very heavy line, and also possibly doing damage to their hips. And then the subject came up of their sit bones. They were thinking of sitting on their sit bones. So first of all, we should understand that we sit on our sit bones when we sit in a chair. As I'm doing right now, I'm sitting on my sit bones. And when I stand up, the weight of my body will be supported by my hip joints. So there's a difference, and many people really don't understand where their hip joints are and think that the hips must be here, right underneath what we call the waist being something for clothing, where our belt would go. But anatomically speaking, we might say that our waist is more at the pelvic floor, or where the torso meets the legs. So we can misunderstand that and not understand where the hip joints are and then not move them correctly. But it's the first time that I realized anyone might be confused about the role of the sit bones when they're dancing. Now it is just about Halloween. Friend here that one of my students brought in. I don't have a nice Alexander skeleton, I wish I did, but they're hard to get. But this will serve the purpose. We've got some rather narrow, funny looking hips there, but you can still see what the sit bones are. And the sit bones are these protrusions, actually called the Ischial Tuberosity, tuberous area of the bone coming out of the ischium, or part of the pelvis. That's what you actually sit on. He's got a really narrow pelvis. So you're sitting on your sit bones. Now these hip joints are not very anatomically correct, and they're quite far to the front, which is unusual. But if I swing them out to the side here, usually the socket would be a little further out to the side. When you stand, then you would stand on this sort of hammerhead of the thigh bone, and that area is called the hip joint. So we can see that a little more of what that femur or upper thigh bone actually looks like. Here it does look very much like a hammer, and that fits into the socket. This is the weight-bearing area when we're standing. So the weight will come down through the spinal bones and out through the pelvis and through this diagonal movement down through the leg bones and into the feet. So again, this is what we're standing on. Now, what's the role of the sit bones when we're dancing? It's more or less an ability to find as a landmark how to engage the pelvic floor muscles. So the pelvic floor muscles would be underneath. So if we would imagine that we're trying to pull the sit bones together, the bones that we sit on when we're sitting upright, if I roll my pelvis back and start sitting on my tailbone, and I'll show some of these pictures anatomically with a better skeleton. There's an app you can get that's really good for dancers to look at. It's called Essential Skeleton, and you can look at the different joints and where they're located and get a more accurate vision if someone tells you to do this or do that, engaging a certain part of your body. So I'd like to know where the sit bones are so that I can learn to access the pelvic floor muscles. So when I want to sit up in dancing, or I want to rise, there are times when I have to engage the core upwards more and engage my pelvic floor muscles to lift up. So when I'm sitting down, as I'm going to sit down, we naturally expand that area so the sit bones or the muscles of the pelvic floor are more relaxed as we go to sit down. Now, if I sit up very straight and I squeeze those sit bones together, my pelvic floor muscles will engage and pops me up out of the chair. So I could say, for instance, when I'm in the tango link, I want to be sitting up. I want engagement of the pelvic floor muscles in the back of my leg. I don't want to be sitting down or in a squatted position. So I'll do some of this standing up. so we can see a little bit better. But I want to get through that confusion of you don't stand on your sit bones. And so when people are rocking back and forth and overly stretching that, that's a misunderstanding of what we're talking about. Sit on the sit bones, you stand on the hip joints, but when we stand, we frequently need to engage pelvic floor muscles. So I'm going to show some of this standing up so you can see what we don't want to do. You don't injure yourself or get yourself in really awkward positions or bad body lines. I did talk about this control of the hip area on my forward walk in ballroom, and I did a second one specifically addressing controlling the hips. Most of us realize in Latin that when we step forward, whether we're doing an American rhythm action or an international action, that we have to control the hip, again, where we're standing with the weight on the femur, on this head here, this hammer fitting right in there. So now we're not standing on our sit bones. We're standing on this head, and we have to keep this underneath us. So that when we do a Cuban motion or any kind of a hip motion, we'll be manipulating that, but we won't be stepping and dropping sideways in the hip in this position. Even when we transfer the weight of our hips and we do what we call the settle, we're still keeping control over the joint area. So that's enough for a whole other subject of how to properly settle or sit and move around that hip joint without getting into a dangerous, overdone, or ugly position. And today I'll talk mostly about this control of the hip in a lateral fashion, because our hips do move forward and back also quite a bit. I'm moving now my hip weight back through my foot, but again, I'm not allowing it to be a sagging back and hip area. So if you were around in the 80s, there was a time in the Latin where many people were being accused of something we called swinging the bell. I don't remember anybody teaching swinging the bell, but I sure remember a lot of dancers doing it. And this was all the talk. Well, what was swinging the bell? I think it was probably misunderstanding of the settling action. And so the dancers were doing a lot of this kind of movement in their fans and walking, and so the whole body was swinging like that. So it's really a misunderstanding of what the settling of the hip is. Now my hips are uneven, so it may look like I'm always sitting on my right hip because it's high, but right now I'm standing on top of it. So that's what we're looking at. There is lateral movement across those joints that we have to do. So again, we hear this soften the hip joint. I feel that I'm softening the joint of the free leg in order to transfer my weight over to the standing leg. Now, this is what this couple was doing that I was working with. They were sitting, thinking they're sitting on their sit bones. They were sitting on their leg bones, but understanding if I had to sit, I would sit down. I would not sit sideways on the chair. So keeping that hip under control, and depending what kind of line we're doing, if it's an open line or closed line, if we're in a closed line with a partner, then we definitely don't want something like that. But we would have that choice in an open line whether we want a level hip or we want a high hip, but we never want this. So that can be harmful to those ligaments and the muscles around there, and bursitis in this area, Trochanter Bursitis, is common in dancers anyway. There's always a bursa around the area where the tendons are rolling over those bones, and that's to protect it. That can get inflamed when this area gets overstretched. So we have to be very careful how we use the hips. So again, keeping the hip line underneath, I can manipulate that hip forward and back. I'm still in a position, let's say, of sitting up. I am not sitting sideways or feeling that I'm sitting down and letting the pelvic floor muscles completely release. Now, naturally, when we do a lowering motion, I will have a sense, whether you can feel it or not, is what's happening of the muscles of the pelvic floor, that the sit bones would be opening because the muscles there are relaxing to ease down, and as I would lift up, I would engage the pelvic floor muscles and up. So again, that's how I might activate the area where my sit bones are, is in getting pelvic floor muscles to engage, but realizing that I'm always standing on the top of my femur. I'm not standing on my sit bones. And when we walk forward, we're going to keep this area engaged so that we don't sit sideways. So this whole look in this couple at the moment was that they were sitting down and sitting sideways. It's just misunderstanding that little bit of the anatomy.